Cook got a sense tonight of how concerned pet owners should be. Catherine?
Well, David, this happened in Central Oregon. Sadly, the cat died, but its owner is responding well to treatment. Doctors say the public should not be concerned, but this is a good reminder to follow some basic steps to help prevent the plague and other diseases. When news of the bubonic plague in Oregon hit this week, it spread like well, you know. But hang on a second.
The likelihood of this happening to you or your pet is extremely rare.
Still, Dove Lewis vet Dr. Hannah Marshall understands the hysteria.
The plague in general, yes, it's very easy to think about the medieval times, the buckets, the rats everywhere, you know, bring out your dead if you watch Monty Python, that sort of a thing. But truth be told, it's an extremely rare disease that we deal with in our pets as well as the human population.
Health officials say the plague infected a cat and its owner this month in Central Oregon. It's the first human case of the bubonic plague in Oregon since 2015. A Deschutes County health officer said the pet owner is alive and has been responding well to treatment. Sadly, the cat did not survive. Health officials say because the disease was detected in its early stages, it didn't spread and poses little risk to the community. Pets can get bubonic plague from infected rodents or fleas and can then transfer the infection to humans. Typically, symptoms start 2 to 8 days after exposure and can include fever, nausea, muscle aches, and very swollen lymph nodes.
So if your pets are on appropriate flea control, then I wouldn't stress at all about this sort of a thing. The bigger worry would be if you have outdoor cats that have high flea or rodent exposure and that aren't on any preventatives or protection.
State health officials say in the rare case the bubonic plague does show up, there are treatments with a high success rate.
And for humans, it's the same thing. We have antibiotics that will treat individuals and prevent an infection right away. But you need to do those prevention components to make sure that you're not exposed and your animal is not exposed.
Another way to prevent that? Experts say avoid contact with rodents and don't feed animals like squirrels or chipmunks. Again, doctors say you don't need to worry. Just be vigilant.
And a lot of it is cluing into, is your cat feeling sick? Do they have flea exposures? Plus, then do you have signs that come on within a few days?
Cases of the plague are rare in the U.S. According to the CDC, an average of 7 human cases, the majority of them bubonic, are reported each year. Back to you.
Hopefully that's the last one we see here. Catherine, thank you.